Hi guys, so I'm back after a month and I definitely have a very good reason why I was not making videos. So how should I begin this? मैं intro कर देती हूँ. Hello everyone, this is Calliope aka Kalpita Naidu. I hope you missed this voice. I hope you missed my videos and a very happy Navratri to all of you. May Goddess Durga bless us all and just let's hope for a better next year, or at least by the end let's hope we get some vaccine. And yeah, this year the festivals are not really being celebrated and it's understandable. So the reason why I did not post a video since more than a month now, I think it's 1.5 months almost. I remember shooting a video on 9th September and I was editing it, okay, but of course I could not post it because on the 10th September 2020 my dad got a brain stroke and it was a major stroke. Of course, the neurologist believed that it was due to COVID, and thankfully there were not many complications, as in because my dad doesn't have any other issues except BP kabhi low ho jata tha, so he used to take regular medicines for that to keep it normal. But the cholesterol was borderline high. I don't think so there were any other issues because he doesn't have diabetes or heart disease, or oxygen level was also fine. But of course he was in the ICU for 1 week and then he was shifted to a special ward. Now, dad did not go out anywhere during this lockdown. We used to not even allow him to go for a walk or anything like that. His COVID test was negative, but the antigen, I think antibody test, was positive, which means that he might have got corona from somewhere through us or someone who had come. It can just come through whichever way, even through asymptomatic people. I was the only one who was going out, of course, to get whatever groceries or to going to the bank, etc. Of course, because he's a senior citizen, he is 80 plus. Senior citizens are more at risk, and that's what the neurologists believe, that they found the COVID patches in the chest x-ray. So their main thing was to get him stable, like all the organs should be stable. That little bit infection which was left, yeah, they believe the stroke happened due to COVID also, and of course it's age related, etc. He had a history earlier also, but I think that time the stroke was prevented, or it was a minor stroke. This was back in 2007, if I'm not wrong, when we shifted here. So yeah, initially they were definitely scaring us that, they didn't want to actually give guarantee. So it was almost like, we don't know what's going to happen. We don't know, we have to wait and watch. So I decided to just keep a positive attitude, and we of course were praying. Everyone of our friends and family, everyone was just praying and hoping for the best, and we gave consent for whatever treatment was going on. So his condition was started improving, of course. His oxygen level also, it wasn't like really bad. He was not put on ventilator and stuff. So yeah, things started getting better in 3-4 days, and in a week's time he was shifted to the special ward. And the only thing is that he should have been made to walk, but unfortunately the hospital he was in earlier did not have the best facility, which is now there at Kokhilaben, okay, hospital. The rehab facility for stroke patients, it's much more advanced. They have like 2 sessions of physiotherapy. Now they have started robotic therapy, and it's great, to be honest. Of course, every stroke patient recovers differently. It depends on a lot of factors, age related. Now this COVID thing is new. Then if it was a major stroke, the recovery might be slow. It also depends on the patient. Okay, like I feel my dad's willpower is there, but he's still weak. Okay, so when you get on the left brain, the right side becomes paralyzed, and if it is on the right, then the left will get paralyzed. So his hand, of course, there is very less sensation, but now he's feeling pain, which means there is sensation, but there's a lot of weakness. Okay, that's why robotic therapy will help. Hopefully we are going to see in 6 sessions. I feel that he should have been brought in Kokilaben earlier, but of course it's an expensive hospital, and let me just say, due to COVID, everything has increased, the expenditures, because the medical bills, because we are also paying for the PPE kits and basic things like gloves and diaper and a lot of things. They are just making you pay for everything. So even in the previous hospital, it was not less, okay, the amount. But I still feel that we should have we should have taken him to Kokilaben. But anyway, the treatment there was not bad. The only thing is that the first 3 months after the stroke are very important when it comes to recovery, because we have to push the patient, whether it comes to physiotherapy or speech therapy, we have to make sure that he tries to improve in those first 3 months. So now we just have like 2 months. 1 month is gone. In fact, you can say more than a month and a couple of days are gone. So now we have 2 months to make sure that the recovery happens fast. But of course, there are a lot of factors, like how much he can cope up with things, how much he's willing to push, okay, and how much his willpower is there. And let's see. We can't see every stroke patient in the same manner, because I know when this happened, there were a lot of people giving us a lot of advice. People who had got a stroke, people whose maybe family members had got a stroke. Every stroke patient is different. You can't really say. A lot depends on the physiotherapy, speech therapy. Thankfully, he's in good hands now. I won't blame the physio of earlier hospital or at home what we were doing. It is just that the rehab, whatever they have, the equipments, whether it is about making him stand or now the robotic thing, of course the technology is better at the hospital and it is there at Kokilaben. Someone had told me, a physiotherapist friend had told me about Masina Hospital also, but that is far away. For us, it's in town. So there are not a lot of these rehab centers, proper rehab centers for stroke patients in India. And of course, the concept of rehabilitation is not really common in India, at least, okay? We were little worried how he will react when it comes to taking him again at the hospital. Of course, he was once emotional, maybe once or twice, but that happens, okay, in stroke patients. And normally also, who wants to stay at the hospital? And especially during COVID times, of course, they're not allowing family members, 2 people to be there. And we have a caregiver for dad, and thankfully we've got someone really good. Dad has bonded with him, so he doesn't really miss us a lot. Of course, he must be feeling sometimes, but we do video calls. I frequently go whenever possible. I will say, when it comes to finding a caregiver or nurse, go for someone through recommendations, either doctor's recommendation or someone who has had such patients at home and they needed someone. Because I went through agencies and I would say they are not great. Okay, someone was great but not really experienced. Someone was very experienced from a reputable agency, but he was lacking compassion, and he raised his voice on my dad once. So all these experiences you might face, and it is mentally really disturbing. We could not sleep at night because mom, of course, she used to come and check. I used to sometimes come and check. For someone who, I understand keeping a 24 hours attendant, it's not easy. Even for that person, you should definitely be considerate that that person gets some sleep. But it is important for, this person to be little compassionate, to be nice with your, family member, patient, whoever it is, and even with you, because this can be a long term thing. Like, even when dad comes home, we have to keep this caregiver with him. We are hoping he at least walks on the walker, okay, and doesn't have to be brought in the ambulance again. We are hoping, and I hope you all also pray for that, because it is difficult seeing, especially your father like that. My dad has been so independent since a young age. He came to Bombay at a tender age of probably 15 or 14, and he started working. He's seen everything, all the struggles, which person who comes from outside of Bombay goes through. He has lived on the footpath, he has lived in slums and chawls, and then brought his house, two houses. He worked his ass off. Then he brought his own garage space, and it was quite a successful business then, due to the fact that service centers were, more there. So the garage business was little less, so we decided to shut down. Even now in his 80s also, he was so used to doing everything himself. He used to wake up early, he used to take the newspaper, take the milk, keep the dustbin, or we used to keep at night now, so take it inside. From taking hot turmeric milk in the morning till to, like, taking bath, then washing his clothes also. Can you imagine? He liked, clothes which were not really washed in the machine. So suddenly you have people, helping you. I'm sure it can be exhausting for him also, emotionally also, and for even us to see him like that. And he did not really get aggressive a lot. That is a good sign, because a lot of stroke patients, they take time to accept this condition and to take help, and they can be aggressive. So thankfully dad hasn't been that aggressive. The only thing is that during the time at the previous hospital, after he was shifted to the special ward, and I think even in the ICU, he used to have the feeding pipe, because he was not able to take solid food, he was not able to chew, and there was this possibility of the food going somewhere in lungs or anywhere else. So that was the reason the feeding pipe was on, and he had tried to remove it from his left hand. अभी भी बहुत ताकत है left side में. So he did that thrice at least. Okay, and it's very difficult, painful also for the patient also, to put it back. So thankfully later on they tried feeding him through spoon, and now he can eat better, food, like semi-liquid. It's not completely mashed. Otherwise we had to actually prepare his food differently. That is also extra work. So here everything at the hospital is from time to time, and that is like, he's busy also with speech therapy, twice physio, now they have started the robotic thing, and of course what else, yeah, food, sleeping. So hope he doesn't lose hope, and this is what is going on. So I have been busy with this. I used to be at the hospital during the day at the previous one, and my sister had come down, so for 2 weeks we were doing that. Of course in the ICU they used to not allow people, but we used to still be there. I'll try to definitely be regular now if possible, but I still go, in between in the hospital whenever they need something or payment has to be made, etc. Another thing is I'm going to expand my clothes selling business. What do you want to buy? I've been thinking Indian wear, mainly kurtas and artificial jewelry. And are you guys interested in buying crystals? Then I can keep that also. What do you want to buy from me? I would be going to meet manufacturers and wholesalers next week, hopefully. So, unfortunately, the trains are not working, so I have to spend on travel. Yes, guys, I don't drive, I don't have a car, and I don't like driving, to be honest. So I prefer public transport. So yes, hopefully I would be, selling through WhatsApp and social media. So yes, that is something I want to do aggressively. So do watch out my social media pages, and I will be making new pages for that. Yes, it will be a lot of work, but I want to push further, and I don't have any other option. I mean, there's a lot of money which is going, of course, and I want to improve my finances and for my future. And I've been wanting to expand this since a long time, so I won't be doing through the app. Earlier I earned a lot on Elanik. Then I went to Kootloot, but I did not really find a lot of potential customers there. So I decided I'm going to do direct selling through social media and WhatsApp. I don't know on Amazon. I don't want to again involve, another like I have to pay them. So I would prefer doing direct selling more. So that is the thing. There is a lot of things to sort out even for that. It's not ki abhi maine bola aur abhi cheezein ho gayi. There is a lot of work to do. Firstly, going and meeting them. So this is what is happening. This is the life update. Why I haven't posted and what I plan to do in the future. Yes, I'm not closing my channel. YouTube will be on forever as long as I can do. But I also want to earn more. Okay, that's the reason I want to expand my clothes selling business and reach to a new level. Please put down in the comments, what you want to buy. My energy is affected a lot lately, especially even when I go to the hospital. So I'm trying to protect my energy, but still it has been a roller coaster, I would say. I haven't really cried a lot. I don't know. It was almost like I have to get things done. This is what I have to do. We can't really back out of it. I mean, it's happened. Whatever has to happen has happened, and we have to get things done. Definitely this difficult time has pushed me further, even in my life, to think about myself and my career more. So whatever happens, I won't say it is for the good. Okay, this is not really great. It should not happen to anyone. But yes, if I look at it from this point of view, then yeah, I mean, some good has come out of it, but there is a lot to do, I would say. So please be patient with me, and please keep supporting my channel. And I will also say one last thing, that whenever stroke happens, God forbid, with anyone in your family, take that person to the hospital immediately, because the injections which they give, that has to be done within 4 hours, and we were 1 hour late. Okay, we reached, I think, after 5 hours. Okay, so yes, during this COVID times it is difficult to get an ambulance, but just saying, try to make the patient reach the hospital within 4 hours. Otherwise they will try to do the thinning process, the blood clot thinning process, through medicines. Through injections it is much better. It is very good to take the stroke patient as early as possible. So we have learned our lesson, and I would definitely advise for you to remember this and follow whatever I'm saying. Okay, COVID is not really over. I know there are a lot of people who just are acting very careless and just roaming about without mask or not carrying sanitizer. Yes, it is less among the youth, but there are cases where the youth, the young people have also got coronavirus and even stroke. So don't think that it cannot happen to you. I know people, even among our family friends, we have lost people. We have lost people of our, like, supposing my mom's friend's husband, he has died. My dad's friend, he has died. Another friend has COVID. Basically, a lot of people, among, I think everyone must be knowing some or the other person who's suffering due to COVID, or someone has died. When it happens to you or someone you know, only then you will understand the seriousness of coronavirus. Okay, guys, so please take precautions. Don't take this lightly. I will definitely advise you to follow the rules and norms, especially when you go to hospitals. There have been people who have got this virus just when they have come for a checkup. So if it's not necessary, don't go to hospital. Try the desi nuskhas also. Get yourself tested, and if you get positive, quarantine yourself. Do not take this lightly. I know there are people who don't think they need to be tested. You're being irresponsible because आपके आसपास या आप जिससे भी मिलते हो, especially if you go out for work and whatever it is, the testing has increased and it is a good sign. But if you, even if I don't know if asymptomatic people are okay, but I think still you should quarantine yourself. The authorities and the doctor will tell you, but don't be assholes. That's what I would say. If you're getting yourself tested, that's a really good thing. I mean, I think BMC also has these now centers where you can get tested, but we had done our test also at home and we were thankfully all negative. Dad got also second time test before we admitted him to Kokilaben. We got his test done first, and next day we got, actually by night only we had got, so next day we took him to the hospital and he was, he tested negative, so that's a very good thing. So that's it, guys. I just wanted to update you all. I have been wanting to make this video since long. Unfortunately, I was feeling sick quite a lot whenever I was coming back from the hospital, and I have motion sickness, but not for short distance. So yeah, it happened in the ambulance also twice, and while coming back, sometimes while going to the hospital. So I'm just protecting my energy, as much as possible. Salt baths, okay, are great when you come back, or even before you go. Just protect your energy. There's nothing, I'm not saying it's negative. I'm just saying that people are anxious at the hospital, and I get affected by energy very easily. So that is what is going on. So please keep my dad in prayers. Even now, it's not that everything is completely fine. We are just hopeful for things and hoping that this was the right decision. At home, it would have been a longer process, and yeah, at home also we were not paying less, whether it comes to the doctor or caregiver. There should be improvement, otherwise it's no point. And of course it depends on the patient as well, his willpower, his age is also there, but I feel he's still managing, he's trying his best. So that's it, guys. I hope you all stay safe, and yes, try to celebrate the festival indoors with family. And I don't know, what should I say? Like, comment, share, subscribe. I've not forgotten the outro. It's just that it's weird asking people to like such a video. If any of your subscribers or viewers have had someone who's who's been a stroke patient or who had some family member or friend who had got a stroke, please write in the comments below your experiences. And yes guys, there'll be a lot of people giving all sorts of advice, but listen to your intuition and listen to the senior doctors. Okay, always get a second opinion if possible from the best people. Yeah, and just do what is right, because there'll be a lot of people saying a lot of things, but do what is right for you and the patient. Okay, please share this video with your friends if anyone needs, you know, some awareness about stroke patients, and especially due to COVID. Okay, even after the patient recovers from COVID, there is brain fog and there is confusion. These things do happen, especially in stroke patients. Okay, so do remember that it can be a slow process of recovery, so don't lose patience with the patient. Okay, and please subscribe if you haven't. Like, what are you waiting for? Please, please, please subscribe. Thank you to all my subscribers. Thank you so much for sticking around. I know sometimes people lose subscribers if you don't post videos, but I genuinely had this problem and I'm still dealing with it. Every day is a new experience, I would say, but just gaining a lot of strength. And I really hope to get positive comments and feedback which will give me more strength. Okay, and if this video helps even like one of you, I would feel grateful and I would feel better. And that's it guys, happy weekend. I won't be going tomorrow to the hospital. I'm going to meet my school friend after ages, and I'm also very excited to meet her dog. So I need a much needed dog therapy. I am waiting for that just to relax because my mind has been all over the place. So yes, this video might not be posted tomorrow. It might take one more day. Okay, so just be patient with me, and please keep supporting. And if you want to check out my last video, it's somewhere here. Until next time, it's bye bye from me. Take care. Take care guys. Please stay safe.